Hi, everybody. Thanks for coming. My name is Stephen Post. I direct the Center for Medical Humanities, Compassionate Care, and Bioethics. And Kat Norte will be handing out a brochure, a little 3-ply brochure for you to have something to take home. Kat, and thank you. Our speaker at this colloquium is Allan Jacobs, a physician and OBGYN with a distinguished career, who also has his law degree and writes very actively in ethics in law. He has served as chairman of the Department of OBGYN at Beth Israel Medical Center and at Flushing Medical Center. He is currently a director of gynecological oncology at Coney Island Hospital. He's published articles in reproductive ethics in premier journals, including the Hastings Center Report and the American Journal of Bioethics most recently, I believe. He is especially interested in the tension between state power and individual rights and prerogatives with respect to health-related issues such as vaccination, access to investigational drugs, and circumcision. He teaches actively with clerkship students and residents across Greater New York, and he enjoys an appointment here as a professor in OBGYN and also in our center. So without further ado, the title, of course, as you know, Ritual Circumcision and Human Rights Beyond the Four Principles. Dr. Jacobs, please. Thank you. Thank you.
First of all, I'd like to thank Dr. Post both for his introduction and for having me here. I was remarking to Dr. Ross about the gender preponderance of women, which reminded me of the difference between interest and commitment. To know what the difference is between interest and commitment, you look at a plate of ham and eggs. The chicken is interested, the pig is committed. Now, the work that upon which much of this talk is based is done in collaboration with Kavita Shah Arora, who is an assistant professor of OB-GYN at Case Western Reserve, who has a degree in bioethics as well. I'm going to talk about pluralism and monism. I'm going to explain circumcision. We're going to talk about human rights in general. We're going to apply it to circumcision. And we're going to propose a rule for when something that people do to children might be unacceptable. I appreciated recently that there are going to be people here perhaps who are not in the medical field who might be unused to some of the kinds of things that are going to be on the slide. And there are going to be some pictures of normal and abnormal penises. If this is going to bother you, well, I'm telling you now. Okay. Now, first of all, you should know that liberalism, which I won't attempt to define, one difference between some liberals and other liberals is whether they're pluralist or monist. And this stems from a couple of paradoxes, neither of which is capable of any rational resolution. One is, how does a liberal society deal with illiberalism? And the other is scaling of values. How do you deal with conflicts in values? And I'm going to talk about each of these in turn. Jacob Levy just published a book. He's not the only person to talk about how to deal with illiberalism, but he's maybe talked more about it than other people and has a lot more to say. He's the guy on the left. The guy on the right is a Amish guy who I found on Google Images. The question is, what if a group of people in a liberal society want to organize their lives according to illiberal principles? If you allow them to do this, then you're denying the benefits of liberalism to everybody. But if you don't allow them to do this, then you're suppressing other people's ideas and behavior. And how do you resolve this tension? Really, by using what you think is common sense. When I'm going to say dogmatically that you're not going to find an answer to this question that everybody's going to agree with. Examples of groups like this would be the Amish, certain Orthodox Jewish communities, etc. And such groups may have authoritarian governance. They may have a ruler. They may have gender equality. They may have other bases for inequality within the group. And this impacts on children. First of all, it impacts on socialization of children because the children are being brought up in a closed group with these illiberal values, education, which is a facet of socialization, and physical stigmata, some of which might be the way children are dressed, and some of which may involve the child's body as well. Now, monists say, take the position, this is our liberal society, we have certain rules, everybody's got to go by them, we're going to take your kids, send them to our schools. If they choose to be Amish after 12 years in public schools, okay, nice maybe. And this was kind of the way this is kind of the way liberals in the United States treated the Indians after the Indians were fully conquered. There was this phrase that was prevalent among the progressive people, which was "kill the Indian, but to keep the man," which is don't let them do these primitive Indian things, but elevate them to be like us. And that's monism. Pluralism is leave people alone as long as they're not bothering anybody else, and as long as, bless you, as long as we don't have to support them. Now, Isaiah Berlin is perhaps the person who has talked most about incompatibility of values, and a lot of things that we think are good things may be incompatible with each other. Justice versus mercy. Equality versus liberty, creativity versus order, excitement versus security, knowledge perhaps versus happiness. And he says things better than I can say things. He says, I must always choose, so what do you do to restrain the champion, sometimes very fanatical, of one or another of these values, each of whom tends to trample upon the rest? And the answer is, he says, let's be pluralistic, let's cultivate individuals and groups with different priorities. Okay. Now, again, what should government do? Should you coerce adherence to certain basic values? Or should you leave people alone as long as they aren't a drain on society? No society is going to be completely monist or completely pluralist. There's going to strike a balance between the two. And of course, all this blends into multicultural issues. The guy on the left is the member of a flagellant society. These are Catholics in certain countries, some of which are advanced countries, who do this in the week leading up to Easter. We see a Native American ceremony. I think you all recognize these other pictures. The one, if you don't, the one on the lower right is a Jewish ritual circumcision called a bris. So what is normative in one society may not be normative in another. Western societies are increasingly multicultural. And what is the appropriate balance between toleration and the requirements for conformity? In other words, between monism and pluralism. Some of these multicultural practices may be illiberal, and some of them may just be things that seem weird to the majority. Now, having set the stage, we're going to talk about circumcision. And first we're going to define what circumcision is, and it's removal of the prepuce, which is the medical term for the foreskin. I'm going to say that female circumcision is a misnomer. There's no procedure that anatomically resembles the male procedure, and when I use circumcision, we're talking about removal of the male prepuce, the male foreskin, and that's what we're talking about for the rest of this talk. And that is a picture of a penis with a foreskin. In infant circumcision, and this isn't a picture of an infant, but it shows how you give a local analgesic block. You inject a local anesthetic on each side of the penis, which is where the nerves are, where the innervation is. And you can also use local cream, which is pretty effective, but not as effective as the injection. Again, this is not an infant, but it shows anatomically what you do. You remove the foreskin where it attaches to the shaft of the penis. This is done with different instruments. This is a picture of the instruments that are used. And as we'll talk about later on, when we're talking about the ethical the ethical implications of circumcision, this is going to prove to be quite safe. And following circumcision, this is what you have. This is a fresh circumcision. Eventually, that pinkness will go away, and it's going to look like the skin of the penile shaft. It's going to be thin. It's going to be sexually responsive, but it's not. It's going to be exposed all the time, and not just during the erection. It can be done for treatment of a specific condition. It can be done for prevention of disease. It can be done for religious or aesthetic reasons. The main medical indication is phimosis, which is adherence of the foreskin to the head of the penis, and that's non-controversial. Non-medical reasons can be aesthetic or religious, and it's required per Jewish and Islamic law. I found out that Coptic Christians also practice circumcision as part of their religion, and in Africa it's performed by groups that are neither Christian or Jewish nor Muslim. Parenthetically, most of the late Renaissance, late medieval Renaissance and early modern painters had their hand at painting the circumcision of Jesus. Well, non-medical circumcision is controversial, as we all know. Some people are very emotional about it. They may think that circumcision is primitive or cruel. They may not like groups that perform circumcision. This comes from comic strips online. The website is foreskinman.com. It is a very interesting site. And people who are opposed to it may perceive circumcision as a violation of the body and not like that. But again, Jews and Muslims see it as integral to their religion. To Jews and Muslims, it is a manifestation of human dignity. It doesn't detract from human dignity. Rabbi Jonathan Sachs, who's a baron, I think that if they knew he was a baron, the people who forced King John to give the Magna Carta by threatening to kill him would turn over his grave, but in their graves. But in any event, England has changed. Circumcision is symbolic of the self-control that is necessary for male-female relationships based on mutual love and regard. This is what Jonathan Sachs says. There are various religious justifications beyond "that's what God said" that you can take for what they're worth, but people believe that either symbolically or actually it elevates humans physically and perhaps in their behavior. Groups who practice circumcision believe God created us as imperfect and wants us to perfect themselves, and this is both an object and a symbol of that. Those who are anti-circumcision sometimes say that God created our body in His image in a perfect form, and that circumcision is marring that. People who are pro-religious may say that circumcision is reflective of self-control and being a moral, ethical person. People who are opposed to it think that it may be reflective of oppression. It may be against freedom. The issues regarding circumcision include, should it be legal for parents to circumcise their minor sons? Should doctors be allowed to do it? And those are two different questions because other people can do it, and Jewish ritual circumcisions are done by people who aren't necessarily physicians. Should doctors ethically perform non-therapeutic circumcisions, even if they're allowed to do it? Should they? And if there's a problem with non-therapeutic circumcision, what, if anything, should society invest in curtailing it, which can range from nothing to putting people in jail to various things in between, and that's a subject I'm not going to get into. But that's always a question. If something's wrong, should it be a crime? Should it be an offense? Should it be a target of educational efforts? Should we just say, okay, it's wrong, but we'll tolerate it? I assume that people are familiar with the four-principle model that motivates clinical ethics. If not, I apologize. We're going to go into the four principles later. But in terms of autonomy, we know that children can't make informed decisions, and parents have to serve as a surrogate. And there's disagreement over what the limits of this authority as a surrogate are. Justice is another of these principles. And what rights and obligations do all parties involved have when it comes to infant circumcisions? Now, there's also disagreements in the literature over beneficence and non-maleficence. In other words, what are the possible risks and benefits of circumcision? When it comes to the medical aspects, I think these differences are pretextual, except perhaps as involved the effect on sexual enjoyment. I think that it's fairly clear what the effects are in terms of immediate health complications and so forth, and we're going to get into that. Well, the principlist model may work best as a heuristic to govern doctor-patient interactions when the risks and benefits are chiefly physiological. It may not be as useful as a heuristic for setting public policy. Well, American, and we're going to go into, I'm going to show you some data later, but for now, with regard to beneficence and non-maleficence, I'm going to say that the consensus in the United States is that there are sufficient health benefits to justify elective neonatal circumcisions, and this principally has to do with reduction in the incidence of sexually transmitted diseases, including HPV, HIV, and others. This is a position that's been endorsed both by the American Academy of Pediatricians and the American College of Obstetricians and Gynecology. The immediate risks of infant circumcisions are minimal. Quality of life impairment is hard to study and is not established, but as I'm going to suggest later, the well-done studies tend to show that there's rarely a problem in this regard either. So can a parent, that's the once-over treatment. We'll go into this issue a little bit more deeply, these issues. Can a parent consent to circumcision as a surrogate, or must consent to an elective procedure await maturity, is a question that we'll address. Is there a right to bodily integrity so powerful that infant circumcision does not survive as a permissible procedure? Is there a right to open future so powerful that infant circumcision does not survive? I'm not going to talk about gender equality issues for a variety of reasons. So these can be addressed from a variety of disciplines. When we're talking about medical ethics, any arguments based on medical ethics are going to provide, if anything, an argument against doctors performing circumcision and not for curbing it. Because medical ethics are about how doctors should behave, their professional ethics. And you don't need doctors to do circumcisions. Well, then you have national values, and national values are going to be distinguished from universal values, and there are things that in one society or another we will do or don't do. These are local. They aren't necessarily germane to other societies, and often they're liberal, even things in advanced countries. In Thailand, for instance, they don't like people to insult the king. We used to have laws against flag burning in the United States. Public nudity isn't allowed in most places. Go to the supermarket now and try to buy horse meat. These are all local values. Most of these things, except possibly public nudity, are common in other societies and don't seem to, the societies seem to survive. Finally, there are universal rights, and a universal right is a law that's universally applicable, or a principle that's universally applicable. What are they? What kinds of rights are they? Who has rights? And against whom may these rights be asserted? Well, the human rights movement began in the aftermath of World War II, when there were a lot of atrocities committed. It was formulated under United Nations auspices, and these are some of the people who were the leaders in the conferences that led to the Universal Declaration on Human Rights. The guy on the upper left is a Lebanese Greek Orthodox theologian, diplomat, foreign minister. The country half Muslim, half Christian. He, by the way, was violently against establishment and perpetuation of the State of Israel. But his country and he, it is unlikely that he had a problem with circumcision. Eleanor Roosevelt, widow of the president, parenthetically beloved among Jews. The guy on the upper right, René Cassin, a French Jew and a Zionist. Mr. Cheng, a Confucian scholar from China, by that time Taiwan. And on the lower right, Richard McEwen, who was a philosopher and a pragmatist. Oh, you must know him.
I knew him. I knew him 2 years before he died.
Student of Dewey, teacher of Richard Rorty, and interested in ancient philosophy. Well, these people regarded human rights as being a shield and not a sword. A shield against the power of government, not a sword for governments to use against minorities. This is a quote, oh gosh, this is the wrong slide. Okay, this is a quote from an article by Marianne Glendon, which has an internal quote of McEwen. And he said, difficulties will be discovered in the suspicions suggested by these differences concerning the tangential uses that might be made of a declaration of human rights for the purposes of advancing special interests. McEwen was wrote in a wonderful style, didn't he? And Glendon translates this as saying, that's a philosopher's way of saying, watch out, the whole enterprise could be hijacked. So human rights are rights a person has by virtue of being human, based on some conception of nature, religion, or good, or it can be international norms that help us to protect all people from severe political, legal, and social abuses. Now, these definitions are very, very different. The first one is a moral or ethical definition, and it can serve as an argument for action, but it's not binding on anybody. You can believe it or not. The second is a legal definition. It's binding if it's the law, and it doesn't need any reasons. And generally speaking, laws don't have reasons in them. The traffic code doesn't say keep it down under 55 because it's dangerous. It says keep it down because under 55, because otherwise you'll get a fine. What kinds of rights are there? Negative rights are better accepted than positive rights. Negative rights are goods that shouldn't be taken away, like freedom of expression, freedom of religion, freedom from torture. Positive rights are something that is a claim on somebody else. Somebody has to do something or give something up to give them to you. A right to trial by jury, a right to be fed, a right to education. Even a right to equality of treatment may be a positive right. It's something that is going to impinge on somebody else. They have to do more than leave you alone. So different rights are accepted to a different extent. Positive rights more than negative rights. Negative rights more than positive rights. And again, within each category, some more than others. The freedom from torture, which is a negative right, is very well accepted. The right to a paid vacation, which is in the Universal Declaration of Human Rights, perhaps not so well accepted. So the scope of rights can be breadth, which we know which rights. Depth. If you have a category, how significant does an act have to be to invoke a human right? And consensus, who decides? How many people have to decide if it's a right for it to be a right? And these are questions that you have to ask. Now, Amartya Sen suggested that human rights have to be unambiguous, that they have to be recognized only in important situations, and they have to be universally recognized. And he didn't mean by everybody. He didn't mean Hitler had to recognize the right, or Pol Pot had to recognize the right. He was talking about the bien passant. People like him had to recognize the right. People like us. And let me give you an example here. I don't know how I'm doing with time, but if I run over, then too darn. This isn't the full content of Article 16, but Article 16 is about marriage. It says that men and women of full age have the right to marry and found a family. Marriage requires mutual consent, and the family is entitled to protection by society and the state. Also, you notice that it's the natural and fundamental unit, but we'll get into that later. Now, here's a hypothetical law. Let's say New York State passes a law saying that people can get married beginning at age 17. Well, let's say you believe that people believe that the age of consent should be 16. The full age of consent should be 16. Then that seems to violate Section 1 of Article 16. But if you believe that the age of adulthood should be 18, then you're letting people marry who aren't capable of giving informed consent, and that's child marriage. And then if you charge people $25 to get married, then maybe you're not protecting marriage, because you're making it tough for people to marry even if they're 30. All right. So the question is, are these really human rights issues? And that's what we mean by depth. how important does something have to be before you say, you're violating a human right? Who's protected by rights? Individuals, groups. Freedom of assembly seems to protect groups. Exemption of religious organizations from taxation protect the churches, not just individuals. Hobby Lobby, which everybody's up in arms about, and people didn't understand the legal issue for the most part because of the way it was reported, is a recent example where it could have gone either way. And the issue really was if somebody wants, isn't whether the issue wasn't can General Motors be a Sikh. The issue was if somebody wants to run his business as a corporation by pretending to be a group instead of an individual, does he give up his individual rights to a right that a group wouldn't ordinarily have? So this is a very complicated and important question. Whom do we have rights against? That is to say, who can't encroach upon holders of rights? Well, we know that the people who wrote the Universal Declaration were aiming this at governments. They were thinking about Nazi Germany and similar governments. Non-governmental associations, yes, according to the UDHR, because they can function as quasi-governments. Private parties, what if I don't like people of a certain religion and I won't work for you because you're a certain member of a certain religion, as opposed to a company not hiring me because I'm a member of a certain religion? Not clear. And so these are questions too. How do we decide as a right? Well, each country can have rights, but they're not human rights. Human rights are based on, legal human rights are based on treaties, international protocols, and customary international law. There's no piracy treaty, but anyone can prosecute a pirate. And good arguments are ethical, but not legal reasons. What does a right mean? Does it mean we think that if you're a good person or a good government, you'll obey human rights law? Does it mean that governments may enforce them, that governments must enforce them, that if governments don't enforce them, they're bad people, that if governments don't enforce them, other countries can come in and make them enforce them? Can they send in the army? Can they boycott you? Other questions. Problems with assertion of rights. We'll go through some of these. Ethnocentrism, multiplicity of rights with conflicts, and mistaken identification of your local rights with human rights. You think that we believe it, so everybody should follow it. Okay, here are two rights. Then this is not from the UDHR. This is from the CRC, the Convention on the Rights of the Child. We want to respect the responsibilities, rights, and duties of parents, but we also want to make sure that the child has access to information and material from a diversity of national and international sources. But the parent wants to raise the child as they want to raise the child in their religion, or they want to raise their children as atheists. But that might not be the way the schools are. So whose rights prevail? The right of the child to hear from people other than the parents, or the right of the parents to shape their children? Children should be protected from all forms of physical or mental violence, injury, or abuse. Wow, that's a hard one, protecting people against mental violence. What does that even mean? If you're disappointed at your kid from coming home with a C, is that mental abuse? Where does it become mental abuse? But also, freedom of the child's religion and freedom to enjoy his or her own culture, to profess and practice. Profess and practice. The Convention recognizes that practice is different from profession. In the United States, especially if I may say so among Protestants, we think of religion as being doctrine and prayer, but a lot of religions' practice is what you eat, how you dress, there are a lot of rules for what you do. Religion is more about what you are required to do than what you're required to believe. And really, every major religion, for instance, except Christianity, has a lot of food restrictions. Again, you see where this is a conflict, perhaps, with regard to circumcision. Ethnocentrism and bigotry. Some laws may be seem to be based on rights, but maybe there's something else behind them. Some countries in Northern Europe ban kosher or Muslim slaughter, and that's because we don't want to be mean to animals. Banning religious insignia and dress in schools in France because religion should only be a private affair. Compulsory education and contraception, Sunday closing laws. All of these have secular justifications, but is that really why these laws exist? I'm going to skip repugnance because I think I'm taking a long time. Sometimes people find it hard to distinguish local rights from universal rights. Spanking in Sweden, for instance, or requiring secular education through high school, which is required in Germany, but we have that famous case where Amish are allowed to pull their kids out of school after 8th grade. Are these local or universal rights? Spanking is criminal in Sweden, but maybe even relatively mild punishment in some Caribbean nations. I just told you about terminating education. Some countries will let you do it, some countries won't. Are there really universal rights, or in having these laws, are you saying what we believe in as a society? Okay, so those people who don't like circumcision say it's physically harmful, it violates right to an open future, it causes physical alteration which the child isn't consenting to. Those who favor it say it may enhance health and medical decisions are parental. It's substituted judgment. An adult in a religious community, in let's say a Jewish or Muslim adult, is likely to have wanted an infant circumcision rather than an adult circumcision because it's much, much safer in infancy. Parental rights, rights of child to practice his religion. Some people say a child doesn't have a religion. A religion is something that you choose as an individual, but other people say that religion is a community that you're born into, and by this time you've read everything else on this list, and we'll talk about it. The medical advantages of circumcision are prevention of heterosexual HIV transmission, prevention of HPV transmission, reduction in penile and anal cancer, obviously cervical cancer as well. All of these are HPV-related disease. Possible reduction of certain other STDs and reduction of UTIs in male infants, urinary tract infections. This is not a circumcision complication. I don't know what this is. If anybody knows what this is, tell me. You can see that curable, not very serious complications are not that common in infant circumcisions. The consensus of a whole bunch of studies, some of which involve places where circumcision is better done than others, is 1 in 1,000 require revision of a circumcision because of a poor anatomic result, and a lot of these are just not enough foreskin was cut off. Loss of penis, 1 in a million. Death, probably 1 in half a million. In children that are not infants, much, much higher. 0.5% need revision, and 1 in 1,000 have a stricture, tightening of the urethra. They need to have surgery for that. Adults, 5% have significant complications. It's much more dangerous in adults than children. It's more dangerous in children than in infants. Someone recently did a population study. He found 1.5 million people who had insurance data, infants who had insurance data, well, infants and children. He has a great name. If anyone can pronounce it, you're welcome to try. He published in the journal Pediatrics, which is a very prestigious journal. And as you can see, you're at least one order of magnitude more likely to get most of these complications if you're older than 9 and a child than if you're less than 1. So circumcision becomes more dangerous with age, and that leads us to quality of life. There's no major problem with urinary function. Aesthetic varies with culture. You see people who say, I think circumcised penises are ugly. You see people who say, I think uncircumcised penises are ugly. The question on which there's controversy is sexual satisfaction. And there's a lot of studies, but they're poor studies. I know of one large case-control study of people who were and weren't circumcised in infants. And there were 3 randomized trials of disease prevention in adults in Africa in which they also looked at sexual satisfaction. In those 3 trials in adults, and remember, it's a much bigger procedure in adults and much more complications, but they found no difference in the male sexual satisfaction. And the same thing was true in the case control study done about 20 years ago in Minnesota. So there's little reason to believe that circumcision has a significant effect on male quality of life, but it's hard to study and it's still controversial. There are a bunch of studies on the other side. The poster, by the way, is from a country in sub-Saharan Africa that's pushing circumcision. These are some of the political leaders of that country. I think this is Lesotho. Open future. What does open future mean? The argument is that if you circumcise people, you deprive, as a child, you deprive them of a mature choice. Well, this cuts both ways, because uncircumcised men have lost the chance to have a safe infant circumcision if they want to be circumcised, and now have to have a more painful, more dangerous circumcision, and all their friends know they're going to be circumcised, so they've lost privacy, they've lost safety. Either way, you can use the open future argument either way, but everything you do loses an open future. We're born, we can do anything, but everything we do blocks an infinite number of other possible pathways. And for instance, how many of you have children who are 3 or 4? Are they learning a second language? If not, you're depriving them of the open future of being able to learn a second language when they are most capable of learning language. What about a kid who's a talented gymnast, and you put them in one of those comprehensive gymnast things? We approve of this. We think that's great. We're creating excellence, but we're narrowing them. Every other kid they know is a gymnast. Compared to what you're doing with circumcision, these things are much, much more massive, and as I said, it's questionable whether an open future is even possible. All right, you see here, and I'm not going to read them off the slide, that except for degrading treatment and security, okay, I did. People have used these rights as saying that's what you're doing to infants when you're circumcising them. Well, is that really what Roosevelt and Kassan and Malik were talking about? Mazur said physical integrity is an interest, not a right, but it is a right not to have one's body used as a means to another's end. I mean, if you're talking about raping somebody, you're violating a right to physical integrity. If you're talking about torturing somebody, but if you're talking about circumcising somebody, you're doing that for their benefit, arguably. At least, and the people who do it are doing it think they are, and that's how people believe in their community. And then again, there's a conflict of rights that we discussed before, the right to practice religion. And then you have to balance the right, which is a major right, which is a minimal right. Now, if you're talking about the right to physical integrity and kids, then you say, what do we do in our majority culture if you should defer elective procedures until maturity, until 18? Should we leave that sixth digit until maturity? A cleft, a hair lip that doesn't interfere with nutrition. You know, the kid can wait till 18 to decide whether he thinks it's ugly or not. Putting earrings on our children, they can wait till they're 18. Giving HCG to make short kids tall, well, you've lost the opportunity by the time they're 18. But do you have the right to make that decision for your child? And then breast implants, which are much more in teenagers, which are very common and much more dangerous than circumcision. What's the difference? Is circumcision riskier? No. Is it more uncomfortable? No. What's the difference? That some are procedures that most people would agree with because it fits with our aesthetic, and circumcision, some people don't because it doesn't fit with their aesthetic. But there have to be limits on toleration of minority practices. This, of course, is a picture of an ancient sacrificial rite. They're sacrificing the baby by throwing him into the fire without analgesia. This is, whether culturally based or not, and this is culturally based, the feud between the Hatfields and the McCoys. Some of you may have heard of it. You can't tolerate this sort of thing in an ordered society. Kavita and I, actually I did, and we adapted it. We suggested a three-prong test to decide whether or not a government should interfere with a procedure. And this is not a legal argument. This is an ethical argument. This is, do you think this is a good idea or don't you think it's a good idea? We think this is common sense. It lets people do things. In some cases, it doesn't let people do things in other cases, but it gives a principled way of drawing the line, not, Okay, one, we look at the effect outside the group. We look at the effect on the people who are having the procedure, and then we have three more constraints. So the question is, does it have an adverse effect outside the minority group that creates unreasonable burdens either for society as a whole or for specific members of society outside the group that's performing the procedure? Significant burden to society, and we're going to go into each of these. Educational practices that don't train children to be economically sufficient may have a burden on society. If they if you don't learn a trade and you can't go to work, then you're going to be on. Someone's going to put you on welfare or something. They're not going to let you starve in the street. Refusal to pay taxes. My religion says I can't pay taxes. Well, obviously that's harmful to society. 80 religious holidays a year, and you better let me take them because that's my religion. With regard to kids, vaccination is the one that everybody knows about. That doesn't just hurt the kid, that hurts society because there are people that the kid comes in contact with who can't be vaccinated because they're too young or because they have diseases that don't let them be vaccinated or because the vaccine just doesn't take. Prong number 2, limitation of the religious practice is warranted if the practice has sufficiently deleterious on the children belonging to the minority group by A, creating a substantial chance of death or major disruption of a physiologic function, or creating other objectively severe harmful effects such as malnutrition or major psychological morbidity. Castration, human sacrifice. These are obvious physical effects. We wouldn't allow that. Child slavery, that would fall under the second the second basis of this prong, and child marriage. Child marriage, not just for sociological reasons, but because when adolescents get pregnant, it's much more dangerous. 3, now we're going to say, even if we're thinking that there is a harm here, the harm has to be actual rather than hypothetical. You know, I could conceive of this hurting somebody. If we do baptism by immersion, maybe somebody's going to get fear of water and won't learn to swim, and someday he'll fall into a pool and drown. No, yeah, that's not a good enough reason to ban baptism by immersion. It has to be likely rather than unlikely. We're not going to ban practices because they rarely cause problems. And finally, the thing you want to ban has to be of a magnitude greater than harms typically tolerated for analogous mainstream problems. I mean, if you're going to ban circumcision, you better ban breast implants and that sort of thing. I mean, are breast implantation and football safer than circumcisions? We let minors do that. We encourage minors to do that in many cases, certainly with regard to football in many places. Okay, what about physicians? I already said it, circumcision is acceptable under each of our prongs. Okay, just because it's legal does not mean that physicians should participate. You shouldn't do it if you have moral reservations. If you don't like my arguments, don't do it. And residency programs shouldn't make people do it if they have that kind of moral reservation. You shouldn't do it if you're not trained to perform the procedure. Obviously, there shouldn't be medical contraindications, and there should be informed consent of all legal guardians. If the parents disagree, don't do it. One parent says circumcise, the other parent doesn't, and the parent who wants the kid circumcised signs the consent. It's unethical. It's also crazy for other reasons. Maximize safety, maximize discomfort, and that's all I have to say. I'll take questions now. Please ask questions that are on topic, though. Okay, thank you very much. Who would like to start us off?
I'm going to have to reject the argument that infant circumcision is equivalent to football playing in a teen and breast implants in a teen. We're not suggesting infants should be allowed to play football or get breast implants. Do you consider that sort of a false equivalence in your argument?
He says that the question is that when we're talking about breast implants and football, we're talking about teens, and teens are able to give assent. They know what they're doing, and infants don't. And I think that's a very good point. You could use other examples. You could use orthodontia, where as often as not the kids are dragged into the office. You could use removal of a fifth digit. There are all sorts of examples that you could use, and I can tell you that no matter what example you use, nothing is going to be precisely analogous. Nothing is going to be precisely analogous to anything else. But I think that when you're talking about football and breast implants and some of the other things that teenagers do, these aren't voluntary choices. These, in many cases, are very socially coerced choices. And even though they're not the same, it's not really the same thing as going into the store and saying, should I get a blue suit? Should I get a brown suit? Should I get a red dress? Should I get a green dress? And so, although it's not the same, I think it's a valid comparison.
One of the more powerful reasons to do circumcision is
Could you start over again? I didn't hear you.
that one of the slides you showed that it's a 50% reduction of HIV infection. But if we don't know the initial risk and the modified risk is deceiving, because it looks a big gain, but maybe we are talking, and it depends where you're talking, you can go from 2 to
Okay, yes. This is, what he says is that the 50% decrease may be a small absolute increase. And whereas in sub-Saharan Africa, 20, 30% of people will get infected, and it's usually heterosexual, maybe it's not so common here where people use condoms and there isn't so much heterosexual transmission of HIV. And that's, and that's an argument that could be used. People have modeled this and would say that circumcision would still save lives even in this country. But some of the European papers, and for instance, the 2010 Dutch Medical Society statement saying that people shouldn't circumcise infants, gave this kind of argument, giving a lot of detailed data on risk of circumcision, but not even trying to estimate heterosexual transmission of HIV, but saying it's low here in the Netherlands, we don't have to worry about it. But people who've modeled it say that although the effect isn't as great as in Africa, it's probably greater than the serious complications arising from circumcision. Wait, someone else.
This might sound like a strange question, but when the circumcision is performed in Orthodox Jewish communities, part of the requirement of the ritual would be for the rabbi to remove the foreskin with his mouth. And I was wondering if you thought that that was a violation of right, because that didn't seem to follow
Okay.
in under the 3 prongs.
Okay. He said that in Orthodox community, that among Orthodox Jews, they remove the foreskin with the mouth, and is this a violation? First of all, there's a slight factual error, but the point is well taken. First of all, it's only ultra-Orthodox communities, and second of all, they don't remove the foreskin with the mouth, but after the foreskin is removed with an instrument, there's a requirement that it be done so that there is a small amount of bleeding, and the blood is removed by sucking it off the penis with the mouth. The procedure is called mitzitza b'peh. But having said that, the question is a good one, and if you're willing to rephrase the question so that the example is what we said it was. So the estimates by the CDC are that 1 in 3 or 4,000 male infants born to Orthodox Jews, 1 in 3 or 4,000 infants born to Haredim, so-called ultra-Orthodox Jews. I think ultra-Orthodox is a term that it would be a disparaging term. They would call themselves Haredi, but 1 in a few thousand are going to get herpes as a result of that. Of those who get herpes, something like a third of them are going to get a serious infection. Now, obviously, to all of us, and we're all concerned about child abuse and an adult sucking on a penis is kind of icky and and probably violates, at least technically, child abuse statutes. But let's posit that there's no humiliation involved or intended, and that neither the infant nor the adult are giving or intending to give sexual pleasure or getting sexual pleasure, and that this really is just a religious ritual. You now have something that I think is a borderline case. And now we ask ourselves, what are we going to do about it? Going to take the kid away from the parents? Put the parents in jail? Is the kid better off? is it going to discourage, will this have a, a deterrent effect? And if you think that it will, then it may be an appropriate thing to do for disease. But, I said I wouldn't discuss it in the talk, but I'll discuss it now. When you're talking about passing laws that affect rare events, and then you really have to ask whether you're doing more good or more harm by enforcing the law, and whether the penalty is proportionate or disproportionate to the offense. I'm not going to answer that question, but these are the sort of thing. Now, I'm Jewish. I'm not Orthodox Jewish. My son was circumcised. My grandson was circumcised. They didn't have that suction ceremony, but I would never have done it. I would never have had a mohel who did that sort of thing. But it's one thing to say I don't approve of it, and I don't. And it's another thing to say I terminate parental care. And I'm not so sure that, I'm not so sure that I do that. Parenthetically, nobody involved, even if the kid got sick, would cooperate with the authorities. Does that answer your question? And I'm not saying that I wouldn't. I'm not saying that I'm not. Maybe I would put them in jail, but it's a borderline. To me, it's a borderline circumstance.
We have one more, please.
I don't have a question. My class has to leave, so we wanted to thank you for your
Thank you for coming.